My name is Ashley Kiley, and I'm a student of physical therapy. Today I will explain how to use mechanical traction for the cervical spine. My patient here has endured a whiplash injury from a car accident about a month ago, causing bilateral paraspinal muscle spasms in the cervical spine region. The benefit of using traction for this diagnosis is to promote relaxation of the paraspinal muscles by interrupting the pain-spasm-pain cycle, or by inhibition of alpha motor neuron firing from depression of the monosynaptic response or stimulation of the Golgi tendon organs. You want to make sure before performing traction on a patient to clear them for all contraindications and precautions. Contraindications to cervical traction include where motion is contraindicated, acute injury or inflammation, joint hypermobility or instability, peripheralization of symptoms with traction, or uncontrolled hypertension. Precautions of cervical traction include TMJ problems, dentures, structural diseases affecting the spine, when pressure of the belt is hazardous, displaced annular fragment, medial disc protrusion, when severe pain fully resolves with traction, claustrophobia or other psychological aversion to traction, inability to tolerate prone or supine positions, and disorientation. Before you get started, make sure that the halter is cleaned and that the table is locked. After that, position the patient in a supine position with a bolster under the knee for comfort. For this patient, I would set the angle of inclination at about 25 degrees so that I can target the lower cervical spine musculature. Then you want to use the knobs here to make sure that the neck wedges are snug against the occiput. Also, we're going to make sure that the forehead strap is snug against the forehead. Are you comfortable? Next, we need to release the rope by holding down the rope release button and pulling on the rope. Then attach it to the metal piece on the halter. And in order to take up the slack, you're going to hold the rope release again until all slack has been taken up. Now it's time to set the parameters. Make sure that the traction machine is set on intermittent traction. Then edit the min and max levels. The normal max level would be between 11 and 15 pounds. So for this patient, I'm going to make it 12. And the min level at 5. Go back and make sure to edit your hold and rest times. For the decrease in muscle spasm, you want a 5-second hold time as well as a 5-second rest time. Lastly, we're going to set the time. The treatment time ranges between 20 and 30. For this patient, I'm going to have her at 20. After the parameters have been set, explain to your patient that they will have a feeling of pulling in the neck, and if at any time they feel pain or peripheralization of symptoms, they can press that emergency button and the machine will immediately stop. So now we're going to start treatment. In order to start treatment, you just have to press the start button on the machine. Make sure to closely monitor the patient while treatment begins for at least the first 5 minutes. You want to monitor to make sure that there's no peripheralization of symptoms, pain, and that the patient's comfortable. The expected outcomes of this treatment would be decrease in muscle spasms, decrease in pain, and increased active range of motion for both cervical rotation and lateral flexion.